Best known for her roles in the Underworld franchise, Kate Beckinsale is as known for her looks as she is for her acting. She recently shut down cosmetic surgery rumors and also denies ever having Botox or filler. Let's take a look at Kate throughout the years and see what we think. In 1993, at the age of 20, it appears that Kate has a rounded hairline. She also has arched eyebrows, good infrabrow fullness, and supratarsal show. Kate has a short to medium philtral length. She has full upper and lower lips. She also has strong cheek and jaw structure. In 1994, at the age of 21, you can see that Kate has a flat nasal bridge. She also has flatter but prominent nasal tip cartilages. And on repose, with her lips slightly parted, she has upper tooth show. In 1995, at the age of 22, when you look at Kate's eyebrows, you can see that they follow a very natural type of pattern. So this is called a fishbone pattern, where there's essentially a crossing over of the eyebrow directions. The upper eyebrow direction is slanted down and lateral, and the lower eyebrow, the hairs are directed upwards and more lateral. At the head of the brow, or the medial aspect of the brow, there is a finer look to it, and the eyebrow hairs are actually directed up. As you get to the tail of the eyebrow, the direction changes to much more lateral. Kate also has excellent jawline definition, and that usually stems from a number of factors. One is the projection of the chin. The more projected the chin is, the more sharp the angle typically is. The position of the hyoid bone also plays a role in how sharp the jawline is. The higher up and further back the hyoid bone is, the sharper the cervicomental angle becomes. The more anterior and lower down it is, the more obtuse the angle becomes. Also, the fat of the neck plays a role. Some people have subcutaneous fat, which is right at that level underneath the skin surface, and other people have deeper fat in the subplatysmal space, and that can also take up space in the neck and create different configurations of how sharp that angle is. In addition, we have submandibular glands that help with creating saliva, and those glands can also take up space and occasionally will blunt that neck angle. And lastly, keep in mind that we have digastric muscles that also can be space occupying in the neck. Make sure to subscribe to the channel. In 1996, at the age of 23, I'm seeing full upper tooth show on smile and some gum show as well. In 1999, at the age of 26, I want to highlight here the importance of the anterior temporal peak, specifically how it pertains to the female hairline. It helps both with framing of the face, because as the temples come in, it looks like the face is more narrow. As the temples are spread out more, the face becomes bigger. So that's one factor. And the other is just the configuration as you go from the center of the hairline out to the sides. When you have that anterior projection, it creates more naturality and it breaks up the flow of the hairline, making it look much more real. So when we're designing hairlines in women, as far as surgery goes, we're always trying to recreate that anterior temporal peak and create some additional irregularity so that it can look as real as possible. And in 2001, at the age of 28, I see some signs of possible veneers. It looks like the color of the teeth is whiter and also the shape of the teeth is slightly modified. In 2002, at the age of 29, I do see some frontotemporal thinning of the hair. This may be due to postpartum shedding, though that usually recovers after about 6 months. And I believe she was pregnant in 1998. But some people are left with more permanent hair loss in that area. Postpartum hair loss usually lasts 3 to 6 months, but for some people it lasts much longer than that and can be permanent, especially in the frontotemporal areas. In 2004, at the age of 31, I'm seeing the introduction of possible Botox to the forehead and the glabella. In 2005, at the age of 32, I see no change, and that's the same through 2007. In 2008, at the age of 35, I do see some deepening in the under eye area, and this is what we call the tear trough region. As we age, the transition from the lower eyelid to the cheek becomes more obvious. And that has to do with the weakening of some of the tissues, as well as a reduction of fat that occurs over time. And in some cases, that fat can actually protrude, and you can get pseudoherniation of some of the fat that lives in the lower eyelid area. In 2010, at the age of 37, I wanted to point out here that Kate has fantastic skin. And that usually has to do with regular routine upkeep, as well as proper sun avoidance. And we will soon be launching our own high-quality skincare products that you can find at feelconfident.com. In 2013, at the age of 40, I do see some signs of a potential brow lift. The lateral end, or the tail of the brow, appears slightly more elevated or at a higher position compared to the head of the brow. She also appears to have accentuated frontotemporal hair loss, and this could be related to the possible brow lift procedure. Also, the forehead height looks bigger, and this could be related to a brow lift as well. Most brow lifts have the tendency of elevating the hairline position. In 2014, at the age of 41, Kate still has a very sharp jawline, but I don't see any signs of a lower facelift at this point. She also appears to possibly have started crow's feet Botox, because compared to her 2012 profile on the left-hand side, you can see fewer wrinkles when she smiles right around the eye. In 2015, at the age of 42, I see more width to the mid-face, so I do think that there's possibly some addition of cheek and or under eye filler being placed here to add additional volume to her face. And it's possible that jawline filler was also added to give a lifted type of look. We have a video that we recently put out on non-surgical ways of lifting the face, and filler is one of them. Sometimes it's HA filler, such as Restylane Lift. Other times it can be Sculptra, which is a different type of filler that helps you build your own collagen. In 2017, at the age of 44, I see no change, but I wanted to point out here that her strong jawline is actually protective against the appearance of sagging over time. We've said this in prior videos, but I think this is a good opportunity to point this out again. In 2020, at the age of 47, I see the introduction of possible lip filler. To me, her lips have always been beautiful and full, but over time, we do have a reduction of volume in our lips, but I think Kate may have started to introduce some lip filler around this time to bring them back to how they used to be. In 2023, at the age of 50, this is the time when there was speculation about potential additional facial work that Kate may have had. When I look closely, I do see some signs of a potential revision brow lift. The tail of the brow just looks more lifted to me than it did in the last few years. The first time that I spotted some signs of a potential brow lift was at the age of 40. So now she's 10 years older, and this is very common in plastic surgery where we do a type of lift and then over the course of time, things start to sag again. And so it's very common to come back and revise the procedure. It doesn't mean that it was a failed procedure. It just means that time has passed and there's been more sagging and people come back for additional lifting surgeries, whether that's a revision facelift, revision lip lift, brow lift. Everything sags more as we age and as gravity takes its hold. So this is not an uncommon scenario. And the total cost of these potential facial procedures is $210,000. Check out this celebrity facial plastic surgery analysis video.